We know that we have more than 26,000 school-age children in Illinois with autism, and we also know that we are not providing an appropriate system of care for them. The appropriation passed by a huge majority in both the House and the Senate this year for the autism program expansion would serve more than 16,000 children in its first year and would affect more than 5,000 providers. We have convened a network of providers representing over 27 agencies and universities who are willing to provide services to some of our most vulnerable citizens here in Illinois. The autism program allocation would provide 12 regional centers across the state, providing expert diagnosis and treatment, family resource centers where we would have visual supports, communication books, videos, workstations, and staff to work closely with families, 4 community outreach centers to provide resources and support, training to physicians, training to educators, training to daycare and respite providers, and 11 community visioning initiatives in which we will work closely with additional community vendors and agencies to provide appropriate services. I would ask you to do whatever is necessary to override the vetoes enacted by the governor. This population has waited a long time for services. My introduction to the autism world came many years ago, working in the field of adult services and people with developmental disabilities. And I can tell you I met many adults with a list of diagnoses as long as my arm. And when I began to do a review with their families to find out their developmental history, oftentimes I uncovered autism as the principal diagnosis that had led them to institutionalization in state ops and had led them to severe difficulties. We know that autism, if identified early and if we treat it appropriately, that these people can have a good prognosis. The program the General Assembly supported in this session will result in generations of individuals with autism leading a more productive, independent life. I do want to mention one of the things that is that we identify as something we need to think about closely when we think about a system of care. North Carolina has had a system of care for individuals with autism that's state funded for the past 40 years. They have a fantastic statistic. North Carolina also has the largest percentage of people with autism that pay taxes in the entire country. It's my dream that Illinois citizens with autism will get the services they need, and they'll live independent lives, and they'll be able to have the honor of paying taxes and working alongside those of us without that disability. Thank you very much.